Hello everyone, I'm Nisha, physiotherapist from NASAM. Today I would like to share with you about shoulder care after stroke. Weakness of one side of the body often leads to shoulder issues. Specific concerns may include shoulder pain, shoulder stiffness, and shoulder drop, which is known as shoulder subluxation. When caring for a stroke survivor, we need to follow careful patient handling procedures. We need to protect the shoulder joint of the stroke survivors during transferring, positioning, and exercises. So dear stroke survivors, make sure your caregivers knows the correct ways to help you. Here are a few ways to protect your shoulder joint. First and foremost, do not allow anyone to pull on your arm, especially during walking, transferring, getting dressed, and showering. Second, when putting on a shirt, always put in your affected arm into its sleeve first. Third, do not attempt any above shoulder level activities unless being advised by your physiotherapist. Fourth, if you're unable to hold your weak arm at the shoulder level independently, you need to use a shoulder support. Wear your shoulder support during standing, walking, and transferring. You may remove your shoulder support when you are sitting and lying down. There are varieties of shoulder support available. Here are a few that we would like to recommend to you. Last but not the least, you need to support your weak arm during sitting. Sitting in a bed, sitting in wheelchair, sitting in a chair with or without armrest, and also during lying down. Careful placements of pillows and positioning may increase comfort and protect the shoulder joint. Demonstration for positioning on the side lying onto the affected side. All you need is 3 pillows and a towel. Place 1 pillow at the center of the bed. Get the stroke survivor to lie there. Moving on to the positioning towards the weak side, which is the left side. Make sure there is a pillow placed under the head. Support the weak hand of the stroke survivor. Open it up. Get the stroke survivor to bend the good leg. Bring the good hand forward, roll over. Get a pillow to support the weak hand. The good hand, place it up. 1 pillow to support the good leg forward. Place it underneath the thigh. Make sure that the knee and ankle is well supported onto the pillow. And lastly, 1 pillow to support the back. So here's the demonstration of positioning on the bed for a stroke survivor with the left-sided weakness. So now we are going to position the stroke survivor into the right side. So first and foremost, place a pillow under the head. You may use 1 or 2 pillows according to the comfort level of the stroke survivor. So get the stroke survivor to use the good hand to bring the weak hand forward and place it onto the stomach. This hand, the good hand, can be open. Bend the good leg. Use your hand to support the shoulder, the other hand for the hip, and roll the patient forward. Keep the weak leg straight at the back. Ask the stroke survivor to bring the good leg forward. Use 2 pillows to support the hand and the shoulder forward. Make sure the wrist and the fingers are open. Ensure that it is well supported and there is a space for the stroke survivor to breathe. Place 1 pillow underneath the thigh, the other below the ankle. Last Lastly, place one pillow behind the back to prevent the stroke survivor from rolling backwards. Positioning for lying in bed, all you need is 2 towels and 3 pillows. 2 pillows to be used for the head support. Place it in a V position. Get the stroke survivor to lie at the center of the bed. Assuming the left side is affected, get both the knees to be bent. Okay, bend your knee. We'll insert a pillow underneath both the knees. Okay, straighten out the knee. You need to elevate the head from 0 to 30 degrees. Use 2 towels to support the affected arm. Turn the weak hand facing upwards. Positioning for sitting in bed. If you have a bed that is flat and you are unable to lift the headrest, make sure that your bed is positioned against the wall so that you can use the wall as your back support. For those of you who can tilt it, lift it up. And we need 3 pillows. 2 pillows directly like this. And 1 up. Okay, place 1 pillow to support the weak hand. So place it up halfway. Wrist and fingers extended, well supported. Lastly, place a pillow below the good hand. Positioning in a wheelchair. Make sure the wheelchair is in a locked position, clear off the footrest. All you need is 2 towels and a pillow. 1 towel to be folded into 3 and place it in the center of the wheelchair. Get the stroke survivor to be seated here. Assuming this is the weak side of the stroke survivor, get them to place both their feet onto the footrest. You may assist with the weak leg if it's required. Roll the other towel and place it beside the weak knee. This is to prevent rotation. Get them to hold both their hands and lift it up. Okay, insert the pillow. The pillow will be used to support the forearm and the elbow. Place it down. Make sure that the forearm and elbow is in contact. Widespread the fingers and the thumb. Alternatively, you may use a table to support the forearm.